Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassell, MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Hi, I'm Miles Hassell, MD. Thanks for listening. This is Walk, Don't Run to the Doctor, which is a regular podcast we do on how you can use lifestyle medicine, how you can use your daily choices to be healthier, to need less medications, to have less long-term health problems, sort of how to build your own 401k health retirement account, not a financial retirement account. And today we're answering a question that somebody sent us about osteoarthritis. And so it's a reminder to all of you out there, feel free to text us, mail us, email us, and the information that you can use to contact us is at greatmed.org. And we're glad to do our best to answer questions regarding lifestyle medicine and common problems, or uncommon problems for that matter. So the patient is Sue, and she's contacting us regarding her aging knees. She's 74 years old. She's 5 foot 7 inches and 120 pounds, so she's not overweight. She's active, and she works, does a lot of gardening. And her orthopedist has told her that her knees are bone on bone, and is anticipating that she'll need a knee replacement or two. And she wants to avoid that. As an internist, so I'm an internal medicine doctor, and of course for us, the best surgery is the one that you don't need to have. So we're all in for seeing how we can help patients avoid surgery. This lady comments that she mostly eats homemade food. She does tend to eat a lot of sweets, and so she wonders what can be done about it. So we're going to talk a little bit about osteoarthritis, which is more than just wear and tear on the joint. It certainly is that. It involves loss of function, damage to tissues, such as the cartilage, and perhaps the underlying bone that supports the cartilage. There can be factors regarding what happens with the value of the synovial fluid that nourishes the cartilage. So that's the fluid in your joint that has all kinds of healing properties. And depending on how well you take care of yourself, it would appear that some people's synovial fluid does better than others. And so there's some genetic influences, there's aging, there's mechanical stresses, prior surgeries or prior trauma, inflammatory factors, all of which affect how badly your joint breaks down. And so the things that we're going to be talking about today primarily involve osteoarthritis of the base of the thumb, the knee, and the hip. It may not work as well in osteoarthritis elsewhere. And so we'll talk a little bit about the uncertainties around lifestyle medicine and osteoarthritis as well. The way you make the diagnosis is by typically some kind of radiology. So we usually have a pretty high level of suspicion, and then some kind of radiology, x-rays, or other imaging will tell us a lot more. But the basic thing that most people are looking for is they want to reduce stiffness, reduce pain, improve function, and where possible, avoid surgery. So let's first of all think about the risk factors for osteoarthritis. And this is important, especially for younger people who don't have any joint problems, is to say to yourself, in 10 and 20 and 30 years, do I want to still not have any joint problems? Do I want to have hips that don't hurt, knees that don't hurt? And so whether you have osteoarthritis that's clinically evident now through, let's say, pain and stiffness, maybe swelling, or you just want to avoid it, remember that risk factors are, first of all, being overweight. Every pound that you add in body weight adds a significant amount of stressors on your knees and hips. And those stressors break down the joint, the cartilage. Any prior joint injury or trauma, surgery would be part of that. Overuse. So if you're somebody who does the same exercise all the time, especially something that's kind of hard on the joint, like running on pavement, then think about having more variety. do a little bit of running. Maybe switch to running on softer ground. Maybe doing rowing or bicycling or frisbee. Any number of things you can do that keep you active, but don't involve the same stressors on the joint over and over again. There's various factors that are hard to do anything about, such as abnormal joint alignment. Some people are just born with funny shapes to their joints. Family history of osteoarthritis, it seems to be a factor. Aging, but none of us can turn back the clock, so that's not a very helpful thing to talk about. And finally, insulin resistance, which is the catch-all that we talk about, the metabolic catch-all that in its minimal sense we would call prediabetes or a metabolic syndrome, and in its fully fledged form we'd call type 2 diabetes. And you sort of know if you're heading into insulin resistance if you have things like high blood pressure, a waistline that's too big, maybe a low HDL cholesterol, high triglycerides, high blood sugars without being high enough to call diabetes. Those are all markers for insulin resistance. And there's something you should jump on for any number of reasons, including your joints, risk of heart attacks, risk of stroke, risk of dementia, risk of cancers. So, faced with those risk factors, and let's pretend you're somebody who already has osteoarthritis or clinically evident osteoarthritis, and that's the group we're going to be concentrating on here. What are you going to do about it? Are you just going to wait until you need a joint replacement? We don't recommend that. We recommend you get in ahead of that and see what you can do to keep that joint working well. And so the first thing is, don't slow down. Keep moving. So in the orthopedic world, this is known as motion is lotion. So you got to keep your joints moving without stressing them to such an extent that you're re-injuring them. So that's where we would caution somebody with osteoarthritis to probably not run on pavement, for example, and have as much variety, as I've mentioned earlier, as much variety in their exercise as they can. But if you do have osteoarthritis, you want to have regular exercise. This improves flexibility, strength, endurance, reduces disability, reduces pain, and probably reduces the risk of needing surgery for the joint. In other words, motion seems to do something to keep the joint repaired. And so we have studies with aerobics, Tai Chi, water walking, resistance bands, progressive and intensity exercise of various kinds. There's probably some benefit in exercises that improve the muscle around the joints, so the hips and knees especially. But the key thing is to pick some exercises that you can do them, and pick as broad a variety as you can. Some things to avoid might be excessive kneeling and deep squats. And for practical reasons, we also say, don't decide you're going to do something that's really not easy for you to do. Find things you can do at home, not things that require a gym or any fancy equipment that you don't already have. On the other hand, if you want equipment, remember there's a ton of exercise equipment out there that's kind of really cheap because people don't use the stuff they buy. So we tend to avoid buying anything new. So as you're exercising in trying to improve your joint health, picture that you're improving the muscle around the joint, adding for greater joint stability, that you're improving the quality of the nourishing fluid in the joint that helps the cartilage regrow, that you're improving the quality of the bone around the cartilage, which gives it more support. And all of that you can visualize as creating this harmony between the stimulus you're giving the joint and the response, which is repairing the bone and connective tissue. So keep all that sort of stuff in your mind, and you're going to be more motivated perhaps to exercise. The next thing to think about is weight loss. So we talked a little bit about getting reducing the trauma on the joint. And the single most effective thing we see in our practice that really improves people's outcome, especially people who are heading into who think that they're going to need a joint replacement, is weight loss. One example we have is a gentleman who was about 80 at the time we started working with him. He had diabetes. He was 50 or 60 pounds overweight, had a really bad left hip, thought he was going to need a left hip replacement. But instead, he lost, over a couple of years, he lost 50 pounds. He reversed his diabetes. He improved the quality of the food he was eating. Every morning, he would spend some time on treadmill and doing some dumbbell exercises, so a variety of exercises. And he was able to avoid the joint replacement. How's that? So how much weight do you have to lose? We don't really know what's ideal. Even 5 and 10 pounds can really reduce the extent of loading, the mechanical loading on the joint a lot, and also usually improves pain a great deal. Ideally, you would get to a weight where you don't have any excess waistline. So when you have a paunch, when you have excessive weight around the middle, that's going to be the weight that's going to do you the most harm. So get down so you don't have much of a tummy. The next thing is insulin resistance, and there's a couple of things you can do to reduce insulin resistance. One is weight loss, like we discussed. Secondly is exercise, like we discussed. This is kind of sounding like I'm repeating myself, doesn't it? The third is minimizing simple carbohydrates. So sugars, foods made with flour would be the two biggest. So minimizing your breads, crackers, pastries, pasta, and sweets, and keeping them for special occasions, your birthday, New Year's Day, Christmas, Easter, maybe a couple of other special days, but just don't be in the habit of routine sugars if you want great joints. And we have good evidence for that from a variety of studies, and some of those will be in the show notes. One of the interesting factors here is the observation that people with type 2 diabetes, which is a group that's been studied extensively, have much higher rates of joint replacement than people of the same body weight who don't have diabetes. In other words, diabetes and insulin resistance and high blood sugars appears to be a risk factor for joint replacement and joint breakdown, independent of body weight. And body weight just makes it worse. But if you reverse the body weight problem, in other words, if you lose weight, your insulin resistance and type 2 diabetes will get better. And if you go to greatmed.org, you'll see a whole outline on how you can reverse type 2 diabetes rather than just treating it. And that works for most people most of the time. And that really, it's useful to just step back for a second and remember that fitness and weight loss transforms lives. It improves joints. It reverses type 2 diabetes in the majority of cases. It normalizes blood pressure, gets you off drugs. It stabilizes mood disorders. It slashes away at prescription drug use, at the need for surgeries, all kinds of benefits. We have pretty good data that suggests that appropriate diet and exercise patterns will cut the risk of cancer by about half or more. So, don't underrate the value of those decisions you're making every day in your long-term health outcomes. So let's touch briefly on my osteoarthritis cocktail. So this is a group of supplements that we typically use in addition to a high-quality Mediterranean-style diet where you are making your food at home, regular daily exercise, probably 2 or 3 times a day in short bursts, and weight loss. So we've already sort of touched on those. And so this is one of the few times where we typically would use nutritional supplements. In our practice, we use nutritional supplements very, very rarely. Nutritional supplements are usually not associated with improved health outcomes. So we only use them in areas where we have seen and where we have reasonable evidence to support a plausible benefit for the supplement. So the first of just one other comment about nutritional supplements is none of the nutritional supplement data for joint disease, for osteoarthritis, is very strong. It's not as if this is a slam dunk at all. And so we've taken the 4 factors that we think that have solid evidence in the literature, plus that we've seen help people, and we use them together. And so we typically would only do this for 3 months. And if people found benefit in 3 months, maybe continue it. If it hasn't helped you in 3 months, it's probably not going to help. So this is not a hardcore, highly evidence-based finding, because the evidence for supplements in joint disease is just not strong. So the 4 things are glucosamine sulfate, about 1,500 milligrams a day, and you can have that with chondroitin as well, but we think it's the glucosamine that's the most important factor. MSM, or methylsulfonylmethane, about 3,000 milligrams a day. The research for this shows benefit anywhere from about 2,000 milligrams a day to about 6,000 milligrams a day. We've chosen 3,000 milligrams because it's fairly easy to achieve, not excessively expensive, and seems to give results in our patients. The third thing is gelatin. We actually probably should mention this first. Gelatin or collagen, somewhere around probably around 7 grams or so a day, which is about a tablespoon of gelatin, or one of those sachets from the stuff you make Jell-O out of. And finally, niacinamide, about 1,000 milligrams a day. And the research for niacinamide goes back to the 1950s. None of it is really super solid, but it's pretty persistent. Plus, niacinamide seems to reduce your risk of things like skin cancer. There may be a true anti-aging effect of niacinamide, so it's worth doing. When you look at the niacinamide data, it's a good example of the kind of findings for all of these supplements for osteoarthritis. But you get these soft, and some of the data goes out to about 3,000 milligrams a day of niacinamide, incidentally, not just 1,000 that we use. And nobody really knows what the ideal dose is, but the reports are sort of improved joint mobility, reduced inflammation, reduced impact on activities of daily living. In other words, people are able to do their normal life every day with less discomfort from their knees and hips, and often a reduction in medication use. The reason we use about 3 months as a trial of this supplement cocktail is because the data generally starts showing benefits anywhere from about 2 to 12 weeks. And so we figure if it hasn't helped by 12 weeks, it's not going to help. And as some of my orthopedists tell me when they're suggesting a joint replacement for one of my patients, they say, you know what, Miles, broccoli's not going to fix this one. And sometimes they're right. A few other things that are worth noting is that people who have more olive oil in their diet seem to get less osteoarthritis. They also get less cancer, less heart disease, less stroke, less depression, so less risk of dying over the course of the study. So olive oil is probably a factor in the Mediterranean diet, and we'll mention later on as well our book, Good Food, Great Medicine, that sort of talks about how to incorporate all this in the overall diet, which is more important than the supplements. Oily fish probably have a property. Oily fish probably have beneficial properties. So we'd suggest if you've got bad osteoarthritis, probably at least 2 or 3 servings of oily fish a week. And that can be tuna, salmon, herring, mackerel, and so on. Sardines. Fish oil itself just doesn't seem to do the job for osteoarthritis. So you could always try it and see if it works for you, but we've not been happy with results of giving people fish oil supplements for osteoarthritis. It's possible that cultured dairy products seem to help in some people. It may be the natural source of calcium, it may be the proteins, it may be the probiotics that improve gut function and somehow help the joint as well. We don't really know. People who have more fruits and vegetables in their diet, so the fruit and vegetables have all kinds of healing properties that could be another hour to talk about. But increasing your fruit and vegetables in your diet do seem to help joints. It also helps you lose weight, so think about that one. There's a few things that we don't typically use that are often mentioned, like curcumin from turmeric, SAMe or S-adenosine methionine. These all have sort of promising preclinical studies, but we've just not seen benefit from them. You can really get into a lot of nuisance with pills and expense with trying too many supplements. So we try to narrow it down just to the ones that we think that we see actually benefit in the real world. Vitamin D may be a factor. Vitamin D supplements don't seem to work, but remembering that some sunlight, healthy sunlight on skin, for example, in around where we live, that would be 10 or 15 minutes in summer on as many square inches as you dare expose without sunscreen. You don't want to get burned, but getting some sunlight is probably good for your joints, and at least in summer. And vitamin D supplements probably don't work for this purpose. Cod liver oil may be a factor here, and of course increasing oily fish, which might include sardines. Sometimes boswellia is used for osteoarthritis, somewhere around 1,000 milligrams a day of boswellia, which is otherwise known as frankincense. It's an Indian herb. We certainly see some patients who seem to get benefit from soft tissue pain with this. We're unconvinced that it does anything for the osteoarthritis. Then there's just a million other supplements that people use. We just do not have any kind of confidence that they actually work. So I won't go into all the details of those. But I will tell you that people who lose their weight, increase their fitness, increase the quality of their diet, reduce their insulin resistance by reducing refined carbohydrates, make more of their own food at home, independent of the supplements, their joints feel a ton better. I can't tell you how many patients we've seen who've come in expecting to need joint replacement, being scheduled for joint replacement, and with given a few months of this kind of approach, found out they didn't need a joint replacement. I was just talking to a lady who we were first working with 15 years ago. She was scheduled for a knee replacement. She lost a substantial amount of weight, reversed her type 2 diabetes, and she has not needed a joint replacement. That's 15 years later. She's now in her middle 80s. Don't underrate the importance of your daily lifestyle approaches for every aspect of your health, including your joints. The sort of additional background information would be helpful that you might want to use is from our book, Good Food, Great Medicine, which is currently in its 4th edition. And that sort of tells you a lot about how to actually apply all this. My practice is internal medicine in Portland, Oregon at St. Vincent Hospital. Our website is greatmed.org. The book I've already mentioned is Good Food, Great Medicine in the 4th edition. And you're listening to Walk, Don't Run to the Doctor. Thank you.